When you think about all the challenges families are navigating today, well, it's a lot. But there's one issue, kind of hidden in plain sight, that affects a really, truly shocking number of children in the U.S.
Mm-hmm.
We're going to dig into that today. The reality for kids living with a parent who has a substance use disorder. And that covers, a whole spectrum, from problematic use right through to addiction.
Yeah, and our goal for this deep dive is really to get a handle on just how widespread this is. We're leaning on some really important new research. There's a study that just came out in JAMA Pediatrics, and also some earlier work from the Journal of Addiction Medicine.
Okay.
And both of them pull data from the National Survey on Drug Use and Health. That's a major national survey, really key for tracking these kinds of trends over time.
Right, interviewing people directly. And the one that just leaps out from the 2023 data, it's staggering. 1 in 4 kids under 18 in the U.S. living with a parent or caregiver dealing with a substance use disorder.
1 in 4.
Yeah. When you hear that stat, you immediately think about, the people around you, maybe schools, communities. It just puts it on a whole different scale.
It really does. The latest figures suggest that's about 19 million children.
19 million.
And, to give that some context, similar research using data from 2020 put the estimate closer to 17 million.
Wow, so that's an increase of 2 million in just a few years.
Exactly. And Sean Esteban McCabe, who led the new study, pointed out that this jump really signals a growing urgency. We need to understand what's driving this and, of course, how to respond.
Absolutely. 2 million more kids. It really makes you wonder what factors are behind that kind of increase.
Yeah.
And it sounds like things get even more complicated when mental health issues are also involved.
That's right. The data suggests that out of those 19 million kids, roughly 6 million are in homes where a parent has both a substance use disorder and a diagnosed mental illness.
The 6 million with that double challenge.
Yes. And as Tai Shep highlighted in his research, this combination, this comorbidity, it introduces, quote, additional risk for the children.
You can see how that would be the case.
Yeah. When a parent is battling both issues, it often means, more instability, more challenges within the family dynamic itself.
It's just hard to fathom the extra weight on those families. Really shows how interconnected these things are.
So, okay, when we talk about the substance use disorders here, what kinds of substances are we seeing most often?
The data gives us a pretty clear picture. Alcohol use disorder is the most common. We're talking about an estimated 12 million parents.
12 million just with alcohol?
Just with alcohol, yeah. After that comes cannabis use disorder, affecting over 6 million parents.
Okay.
Then there's polysubstance use, that's using more than one substance, affecting around 3.4 million parents.
Right.
And then prescription drug use disorder impacts just over 2 million parents. And finally, illicit drug use disorder, things like cocaine, heroin, methamphetamine, that affects a bit over 500,000 parents. That 12 million figure for alcohol, it's really striking, especially because it's legal, it's, socially integrated in many ways.
It is. And the accessibility certainly plays a role there.
So for the children growing up in these environments, what are the potential impacts? What does the research tell us?
Well, unfortunately, the potential consequences can be quite serious. Vita McCabe, another researcher in this area, emphasizes this. These kids are more likely to experience adverse childhood experiences, or ACEs. Things like neglect, abuse, or just general household dysfunction.
Right, the instability we mentioned.
Exactly. They're also more likely to start using substances themselves, often at an earlier age and more frequently than their peers. And on top of that, they face higher rates of developing their own mental health conditions down the line.
It really paints a picture of a potential cycle, doesn't it? One that could be really hard to break.
It can be, yes. It underscores the need for intervention and support.
But importantly, the research does stress that help is available, right? There are effective treatments for the parents.
Oh, absolutely. That's a crucial point Vita McCabe makes, too. There are evidence-based treatments. For alcohol use disorder, for example, medications like naltrexone or acamprosate can be effective.
Okay.
For cannabis use disorder, cognitive behavioral therapy, or CBT, shows good results. And for opioid use disorder, medications like buprenorphine or methadone are often vital parts of treatment.
So the treatments exist.
They do. And alongside treating the parents, there's a strong call in the research for expanding early intervention resources specifically for the children.
Ah, that makes sense. Support for the kids directly.
Exactly. Helping them navigate those challenging home environments is just as critical as helping the parent recover. It needs to be a two-pronged approach, really.
A whole family approach, almost. Now, you mentioned earlier that a lot of this relies on the National Survey on Drug Use and Health. Tell us a bit more about why that survey is so foundational here.
Right. The NSDUH, well, it's been conducted annually since the 1970s, which is, incredible longevity for a survey like this.
Decades of data.
Decades. And because it interviews a large, scientifically selected sample of the U.S. population, it gives us a really reliable snapshot and long-term view of substance use and mental health trends across the country.
So it's the bedrock for researchers, policymakers.
Pretty much anyone working in this field relies on it heavily. It lets us see how things are shifting, where problems might be growing, where we need to focus resources.
It sounds absolutely essential, which makes something I read recently quite concerning, something about its future.
Yes, that's unfortunately true and a major point of concern right now. The future of the NSDUH is, well, uncertain. There have been significant staff and budget cuts reported at SAMHSE, that's the Substance Abuse and Mental Health Services Administration, the federal agency that runs it.
Cuts? How severe?
There were reports earlier this year that the entire staff responsible for the survey received layoff notices.
The entire staff?
Yeah.
Wow.
So if this survey were to be discontinued or even just significantly scaled back, it would be a massive blow, a huge loss for public health surveillance.
I can only imagine. If we lost that data stream, what would that mean for tracking issues like parental substance use?
It would seriously hamper our ability to see what's happening. We wouldn't be able to monitor trends accurately. We wouldn't understand the true scope of the problem as it evolves. And crucially, it would make it much harder to design and evaluate effective prevention and treatment programs. We'd essentially be, flying blind in many ways.
That's deeply worrying. It really highlights how important that kind of ongoing data collection is. You can't fix what you can't measure, right?
Precisely. Investing in this kind of public health infrastructure is fundamental.
Okay, one other point that came up in the research involved changes in how substance use disorder is actually defined. How did that play into these numbers?
Yes, that's an important nuance. The study in the Journal of Addiction Medicine back in March, the one led by Tai Shepis, looked at this specifically. They examined the shift from the older diagnostic manual, the DSM-IV, to the current one, the DSM-5. The definition of substance use disorder was updated, broadened slightly in the DSM-5.
Broadened how?
It combined some categories and adjusted the criteria threshold a bit. And what Cephas' study found was that this change in definition by itself actually accounted for a noticeable portion of the increase in the estimated number of children affected.
So some of the rise we're seeing isn't necessarily just more parents struggling, but also reflects a change in how we're counting and classifying the issue.
Exactly. It's a methodological factor we have to keep in mind when we compare data across those diagnostic changes. It doesn't negate the real increase, but it adds context.
That's a really useful distinction. Okay, so if we try to sort of pull all these threads together now, what are the absolute key takeaways from this deep dive?
I think there are a few main things. First, just the sheer number of kids, potentially 19 million, 1 in 4 living with parental substance use disorder is huge. And it looks like it's trending upwards, which is obviously very concerning.
The scale and the trend.
Second, the significant overlap with parental mental illness, that 6 million figure, adds a whole other layer of complexity and risk for those children.
Right, the comorbidity challenge.
Third, and this is crucial, effective treatments are available for parents. We need to focus on expanding access to those treatments. And just as importantly, we need more early intervention and support services aimed directly at the children growing up in these difficult situations.
Treatment for parents, support for kids.
Exactly. And maybe a fourth point is the precarious situation with the NSDUH data. Losing that survey would be a major setback for addressing this whole issue effectively.
Definitely. So considering all that, the scale, the complexity, the potential data loss, it really makes you pause and think about the wider impact on society, doesn't it? What kinds of new approaches, maybe more innovative solutions might we need to even start thinking about to really support these kids and families effectively in the long run?
That's the big question, isn't it?
Yeah. It certainly brings home how these individual family struggles ripple outwards and affect the health of our whole community. Lots to think about there.